Okay.
But it just wasn't lying.
Oh, yes, yes, true. I'm just going to tell you something about writing today so that you can start participating in the class. That's a basic, that's the first thing, and that's one of the most difficult skills we have in OET. So I need to address that. I need to tell you the basic format in which it's written so that you can produce a letter and we will do the correction. And I'll see that you're ready to participate in group classes. We are also going to talk about speaking, but it's not required today. I told you that we can divide our sessions into two pieces, two parts. Speaking and criteria. I'm only the criteria for speaking and criteria for writing. I'm only going to tell after you have produced a letter, after you've written a letter, because I'm pretty sure that you're going to make a mistake and actually want to see your style of writing so that we can develop it, right? That's also the intention. So just listen to me carefully. It's a very, very basic thing that I'm going to tell you. And so I think you're quite aware that there are three kinds of writing in OET. That is your referral letter, then we have discharge letter and transfer letter. But irrespective of the type, they have same format, right? So let's talk about the format. Let's imagine, so the left-hand side top corner, that area is for the person who is going to receive your letter, right? So let's imagine you're writing to a doctor, okay? So let's imagine a doctor's name. How do we, let's say, Dr. Let's say Sally Hansen. It's completely imaginary, doesn't matter. Let's say cardiologist. Let's say Royal Perth Hospital. This test comes from Australia. That's the reason why I have mentioned the address of Australia. Just put an imaginary PO box number or something like that. Let's see, Australia. USTRALI, Australia. Let's see, 10086. Who cares, right? So we have given the patient's name, not patient's name, sorry, the reader's name. We're writing to the cardiologist. You are the writer there, Nikhat. Then the cardiologist, that's a designation. I mean, the position of the reader in a particular hospital, that's the address. The address can vary, names can vary, but this is the basic thing that you need to know. After that, we have one line space, and you need to be very careful with these. There is a specific format set by OET, and you need to abide by that. Otherwise, there will be layout reduction. I mean, there's a criteria from which the points will be reduced. So one line space, right? I'm a terrible typer. I am very bad at typing. Anyways, so let's see, one line space. After that comes date. So write any latest date that you see on the case note. The question paper in OET that is called a case note. Why? It's actually a progress note when the patient is either admitted or when the patient presents on outpatient setting, right? So after that, we have a date. Let's imagine today's date. What is the date today? It is 20th March. Okay, okay, that's 20.03.20. Oh, sorry, 2021. So on this particular date, you're either writing a referral letter, or you're writing a discharge letter, or you're writing a transfer letter. It's very easy to spot this date. The latest, the most recent date on the question paper or the case note is called the referral, discharge, or the transfer date. Okay. There are many formats in which it can be written. This one in particular, I've used dot format. You can use slash format, for example, like this, 20/03/2021. You can write, or you can write it in the full British version. That's 20th March 2021. Sorry, 202. I'm terrible at typing. I'm sorry. Here, anyways, you could even keep it short, like this, simply, straightforward, 20 MAR. You can do that as well, 2021. So it is completely your choice. You do whatever you have to do. That is up to you, which format you choose, okay? After that, we have, again, our old friend back. That's a one-line space. We should never forget that. After that, we have Dear Dr. Hansen. Sorry. So you must be noticing that we have picked up the patient's position, that's a designation. Let me color it in blue so that you have a better understanding. And we have taken the patient's family name or surname in British English. So we've taken that here, and let's say that we're giving a double respect to the reader of the letter that we have to write. That's a compulsion, right? You get it? Now, there are three versions of this: with a comma, or Dear Dr. Hansen, with a colon, or we have another version that is without anything. It has its implication, but I'm going to disclose that later. Just understand that there are three versions. Okay? Now, what is the difference between colon and a comma? Most popularly, comma is used or nothing is used, but you can even use a colon because it is considered the most formal form of expression, especially in this kind of circumstances. Now, the difference between colon and a comma is like, going on a wedding wearing suit and going on a wedding wearing jeans and t-shirt. So you can consider comma as jeans and t-shirt, and the colon is going to be a suit. You get it? But anyways, you can go on a wedding wearing any of them, either of them, right? So it is up to you again. If you want to use a comma, use it. If you want to use a colon, that's your choice. And again, if you don't want to use anything, that's also your choice. After that, we have our old friend. That's one line space. What do we do here? So this is called RE part, can be written both in uppercase, or we can write one uppercase and another lowercase. Very, very important. So what does this area involve? This is the information of the patient who is being either referred, discharged, or transferred, right? So let's imagine a patient's name. So Mr. Michael Clark. I watch a lot of cricket. That's why this came to me anyways. Clark. We can even write about the age of patient. Let's say it's 56 years old. Right? There are many formats here. You can write it like this. AGE, then put a colon, and then write 56 years old. Or you can write AGED, or put a colon and write 56 years. Or you can just write age 56 simply. So again, that is your choice. Do whatever you want. But there are also instances where in the case note, they give date of birth and age both. So you can write date of birth in RE part. I will tell about what you do with the age if both comes in the exam. You can even write about the marital status of the patient: married, unmarried, divorced, widow, widower. Everything can be written. Let's say let's say widower. Right? You can also write about the profession of this person. You can write teacher, small. You can even write next to kin son's name, whoever is the primary carer. You can even give the address of the patient in this area. Depends on the case note and the necessity. Right? You're going to learn that slowly. Don't worry about that. But just remember that RE part, there's a referred to part, that is just for the information of the patient. Right? After that, we have our old friend back. Right? So I must have mentioned you during the, or maybe I haven't mentioned you, but OET is written around 200 words. It can be 180, you can even be around 220. Depends on how the case note is. So your counting actually begins from now. So whatever I've written, RE and anything above that is never going to be counted. So your counting starts from here. This is intro, or introduction, right? So let me color this into red so that we have a proper understanding. So from here, the counting begins. So you don't have to write intro in the real writing. I'm just writing it to make you understand. I hope you understand that fact because one of my students wrote intro in the letter because of the orientation for writing. So let me talk to you about the popular formats. Don't write that as well. The popular formats in which the intro is written. So it's like this. Look at this. I am writing this letter to refer, or if it's discharge or transfer, you write it. You write either of them. You don't need to note anything down. I'll send you this file just to understand what I'm saying. I'm writing this letter to refer Mr. Clark. you must be noticing one thing, that I have removed the patient's given name. So once the full name has been specified at the top, you don't need to give the full name again. We just use the surname or the family name throughout the letter. So we have taken Mr. from the RE part and Clark from the RE part as well. So Mr. Clark, who I'm writing this letter to Mr. Clark, who has MI for further evaluation. Done? Sorry, that's a spelling error. Or there's another way. Thank you for seeing or accepting Mr. Clark, who, same story after that. Or you develop your own style. You can write this letter is to request for evaluation of Mr. Clark, who has MI. So no matter how you write, as long as you're formal, you're safe. You get it. You get my point, right? Let me color it into red. So this is the zone from where the counting actually begins. Now let me tell you, what is introduction and what is the value of introduction? Intro should only have two things: what happened to the patient or what is going on with the patient. Why do we refer? We either refer because we can't handle the patient anymore, the patient's current condition. We refer the patient when we are not able to diagnose the patient, maybe, right? So the reason why the patient is being referred, maybe it's a provisional diagnosis, maybe it's a confirmed diagnosis. We are writing to a specialist, right? So the number one ingredient for your intro is going to be what happened to the patient or whatever is going on with the patient. And number two is what do you want from the reader? So what do we want from the reader? Look at that. Tell me, what do we want from the reader? We want evaluation from the reader. Maybe sometimes we want management from the reader. Maybe we want assessment from the reader, but that will be told in the case note and you'll be able to pick it up very easily. But remember that intro should not be written very long and in a complicated way. It is like a trailer of the movie. When you watch YouTube, whenever a new movie is about to be launched, the trailer is never going to be 1 hour long or maybe 30 or 40 minutes long. Otherwise, the viewers will not be attracted. They will already figure out the story, isn't it? So you need to keep suspense. You don't need to tell a lot of things. No, of course, you can mention the age. Remember, I told you that if date of birth is given, then put it in the RE. And if age is given, I mean, what I mean is DOB and age both are given, that you can write date of birth in RE, and in your intro, you can write a 56-year-old man. That is that you can do if both information given, right? So the conclusion of this part is that what is going on with the patient, the first ingredient, and the second ingredient is going to be what? What do you want from the reader? That's it. We don't write anything. After that, we have our old friend back. Never forget this space. After that, we have body paragraphs. That's the movie where the movie started now. Again, we have one-line space. I'm going to come back to body paragraph later, but just understand that body paragraphs exist. It can be number, it can be many, it can be 3, it can be 4, it can be 2, depending on your necessity. Okay, I'll talk about that later, but just understand that body paragraphs do exist, and this is actually the beginning of the movie, so it will be details. So whatever you've given there, you're talking about myocardial infarction in your intro. That means in the body, you're going to prove the reader that the patient has myocardial infarction. How would you prove that? Maybe the ECG findings, maybe the patient is breathless, maybe the patient suddenly collapsed. Those features are going to be explained with blood pressures reading and whatever the interventions and whatever the tests you have done, right? Angina or whatever, blah, blah, blah. Then let's say body 3. I'm going to make it standard body 3. ODY body 3. And again, we have one-line space. So if we have an introduction, so we also have a conclusion, right? We also have a conclusion. So let me color this into pink. Why did I color this? So counting actually only lasts till here. After that, it is not counted. So what do you do in conclusion? In conclusion, let's talk about the popular format. Popular, that means you can make your own if you really want to. In light of the above, right? I believe you will manage, Mr. Clark. Okay? Or you can simply write like this, considering the above. This is also another popular one. Considering the above. Again, same story. I believe, and blah, blah, blah. Or you can simply write kindly evaluate or kindly manage, M-A-N-A-G, manage the patient as ye be appropriate. You understand? No matter what you write in the conclusion, there's one prerequisite. That is going to be, there has to be a request. There always has to be a request in the closing. Done. After that, we have our old friend back. No counting from now on. After that, you have yours sincerely or faithfully, right? Again, we have our old friend back, and then you write doctor. Done. So the counting begins from the red zone and ends at the pink zone, and whatever you write doesn't matter. Now, what is the thing with sincerely and faithfully? When do we use sincerely? When do we use faithfully? Actually, we learned this in our middle school already. So this is kind of revision for you. If the name of the doctor, let's imagine here, Dr. Sally Hansen is not given, I'm removing it, Command X, gone. If it only writes cardiologist, then you need to write yours faithfully. In the event when the name of the reader of the letter is not given, you use faithfully. And if the name is given, like in this case, Dr. Sally Hansen, you're going to use yours sincerely. Okay? Sincerely for known reader, known name, faithfully for unknown name and only designation. I hope you follow this. Now, let me talk to you about this three things that I had mentioned. Dear Dr. Hansen with a comma, Dear Dr. Hansen with a colon, or Dear Dr. Hansen without anything. So if you use without anything, if you write, then at the bottom, after sincerely, you're going to have nothing, or after faithfully, you're going to have nothing. No punctuation. So if you use any punctuation at the top, either it is a comma or a colon, you have to put a comma here. You understand? Any punctuation used in that section at the top will have a comma at the bottom. If you have nothing, this will have nothing. Do you understand?
Yes.
Okay. So this is the thing I need to tell you. Now, let's come back to the body part. And what is the meaning of body part? Let me tell you. How? Let's imagine the patient visited to you in an outpatient setting twice or thrice, or maybe even four times. So you can design your body paragraphs accordingly. So body one can be today's visit. Body one can be the first visit. Maybe body two can be second visit, third visit, depending on how many visits are there. Or maybe the patient was hospitalized for 4 days. Who knows? If the patient was hospitalized and is going back home, that is a discharge letter, isn't it? So, what are the events of 3 days when the patient, whatever you did during those 3 days of hospitalization, has to be mentioned on separate date? They are body. So, if you're writing about MI in the first paragraph, that means intro, you're basically expanding and proving the reader how you diagnose with MI and what you exactly need. How was the first presentation? What is the family history? Maybe the patient's father died of myocardial infarction as well. Maybe you write that in the body three. Please note that the patient has a family history of myocardial infarction related to her father or related to his father, right? He also has a history of diabetes and blah, 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 blah. You're right. So information you're arranging according to the body. So maybe the body one is today's visit. Maybe the body one is the first visit. Whatever you feel like writing, please do it for the first time. And after that, I'm going to teach you the real game, real criteria on which your writing are going to be based in future. But first of all, attempt it. So I'm going to cross this screen out. After that, let me show you your homework today. Okay. I am going to put something on your screen at the moment. Now, this is going to be a homework. We are going to do a very simple case of Daniela Starkovich. Are you able to see it clearly, Nikhat?
Yes, yes, sir.
Okay, so this is what it is. So it's 5 plus 40 minutes game. I've already told you the initial 5 minutes is the reading time. You're not supposed to use any writing devices during that 5 minute period. And the only writing device is pencil, so don't do anything. One of my students did that, and she had problems in the examination. After that, we have 40 minutes, and in those 40 minutes, you're supposed to produce a letter that is around 200 words. What do I mean by around? It doesn't have to be exact like in IELTS. In IELTS, you have to be 150 or you have to be 250. If you're if you're exceeding that word count, or if you're below, you'll be penalized. But here, it doesn't happen, right? So let's read this out so you understand. Now, Mrs. Daniela Starkovich is a patient in your general practice. That means you're a GP. You must also understand one fact that in England and in Australia, where this test comes from, uh, a community, people, citizens in the community first go to their community health center, and there will be a GP who will be attending the patient. And if the GP deems appropriate for the referral, then only the referral is made. Otherwise, the GP treats the patient. You understand? So remember, let me tell you, let's say this is a community hospital, and there's going to be a GP here. I'm terrible at drawing, but you understand what I mean. GP is here, maybe GP nurse. Let's say this is a tertiary center. Huge. This is a big building. It's ugly, but still it's a big building. Just understand whatever, right? So if the GP resides here, if the GP thinks that no, he can't handle the patient anymore, so he's going to send the patient from left to right. That is from the community center to the tertiary center. This is called a referral letter. In the referral letter, like you remember, where is Mr. Michael Clark going? To Dr. Sally Hansen. And who is Sally Hansen? He's a cardiologist. So we are writing from a GP to a specialist. And after the patient has been admitted in the hospital, the patient returns back home, isn't it? Is not going to live in the hospital forever. And when the patient returns back home, that is going to be a discharge letter. This is the difference. Okay. Now, so it clearly specifies at the top of the letter, I mean, not the letter, I mean the case note, that you are a general practitioner. So this is a referral letter. So let's see what it says. It gives you all the details. Look at it. There is a name, Mrs. Daniela Starkovich, 45 years old, married to 2 children, past history, migraines, medication nil. So that's a date there. You see, January 20th. She presented on that day with abdominal pain, doesn't like fatty foods, otherwise well. And 10 days before that, that means January 10th, she also had similar issues. Look at that. Epigastric pain radiating to the right side 1 hour after dinner, associated nausea, no vomiting, regurgitation, pain constant for 1 hour, no medication, blah, 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 blah. But last night, look at what happened. Recurrence of similar pain, worse, duration 2 hours, vomited once, no hematemesis, and then we have pain, constant colic features, aspirin taken twice, right? No relief. Uh, okay. Overweight with temperature and blah 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 blah. We have this, right? After this, let's see. Mild tenderness in the right upper quadrant, no mass, no guarding, no rebound, blah blah blah. Wait 1 second. Oh goodness. Sorry, that was my cat here. Anyways, look at this. So last night, these were the findings, and after that, we kind of think either the patient has biliary colic or peptic ulcer disease. So we plan following tests: liver function test and a biliary ultrasound. And RV means review in 3 days out of 7 days. That's an Australian system of writing. So this is today. The patient comes with all the reports that were ordered yesterday. No further episodes, patient anxious about possibility of cancer, LFT, blah, 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 alkaline phosphate, and this, right? And now we think it's mild obstruction, and USG confirms the diagnosis, right? And we come with the fixed diagnosis that is cholelithiasis. So we need surgery. So since we are a GP, we are not entitled to do those kind of procedures. That's why we need to send the patient to a tertiary center. And then the whole game begins. Look at that. Reassurance was the plan. Reassurance about cancer. Referral to Dr. Andrew McDonald. Further management, possible cholecystectomy. Look at this and read it. Using the information in the case note, write a letter of referral to Dr. Andrew McDonald, a general surgeon at North Melbourne Private Hospital, blah, 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 blah. The main part of the letter should be approximately 180 to 200 words. So who is writing the letter? You. Who are you writing the letter to? Dr. Andrew McDonald. Now, look at how many dates are there. So the 23rd is today's date, and that is the day when we have diagnosed the patient with cholelithiasis. That's going to be one body paragraph, maybe the initial presentation or the combination of initial presentation with the 10 days history is going to be another body paragraph. Maybe last night is going to be another body paragraph. So it is up to you how you're going to decide. So I'm going to give this decision to you. You are going to produce a letter abiding the format that I've just told you a while ago. And you're going to submit the letter to me, and we're going to do the correction. Let's see how it goes, and then I'll tell you the real criteria on which you're going to base your writing. But first, you need to make a mistake. Remember this. Okay? Any questions so far?
I think no, sir.
What?
No, sir. Only tension not trigger.
No. Why is there a tension? Left-hand side top corner, Dr. Andrew McDonald's, his address. One line space, date, that is 23rd. One line space, dear Dr. McDonald's. One line space, RE part. What is the name of the patient? Daniela Starkovich. Age, 45 years. You can write married as well. If you want to write 2 children, that's going to be fine as well. After that, what are you going to write in your intro? What is going on with the patient and what do you want from the reader? What do you want from the reader? Cholecystectomy? You need a surgical intervention. And what is going on with the patient? Cholelithiasis. And in the body paragraph, you're going to tell why you think the patient has cholelithiasis. Then maybe you can go to this date, 23rd, where it proves that the patient has cholelithiasis. Then that's going to be a body one paragraph where the movie begins. You're going to tell all the values of the tests that you had ordered and the USG findings. After that, you're going to tell Dr. McDonald's about the history, how it developed. So you can say that on this particular date, she had initially presented with this kind of symptoms and blah, 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 blah. And you're going to give a brief description how you had managed the patient initially, and done. Then you have one line space. You're going to close the letter with, considering the above, in light of the above, I believe you will further evaluate, or I believe you'll further manage, or I believe you're going to intervene her with a surgery, with surgical intervention. Then again, one line space. Since the name of the person who you're writing to is given or has been given, you're going to write yours sincerely, one line space, and that is you, doctor. So what you need to do here is that you are just going to expand all these points that are given into sentences. That's your job. Okay, so let's see those skills, how you do it. And it is quite normal to have difficulty for the first time, but I'm 100% sure that you're going to crack it very soon. Okay? So I will drop this file. I'll send this file to you right away.
Okay.
There you go, there you go, there you go. Yes, I'm currently dropping it to you. And
yes, कतिवटा हुन्छ सर राइटिङ चाहिँ एउटा हो कि one letter?
Yes, of course, only one. Only one writing, 2 speakings, and then 1 reading, 1 listening. Okay, we'll come to that, don't worry. Just think about this at the moment. And rest will all be managed slowly, okay? So I've already sent you must be noticing, no, I haven't sent you yet. I put it on somebody else's group. There you go. We're not speaking any Nepali in the class, please.
No, not Nepali.
You're already American, isn't it? You are in America. You've already
Okay,
finished your
already.
USMLE, so you're going to be American very soon. So you get habituated speaking only in English with me.
English.
It also kind of
Okay, sir.
programs your head, for speaking. Okay. So do this homework and just contact me as soon as possible.
So, where did you exactly send it? So I didn't receive any.
You're going to send it to me on WhatsApp or Telegram, and then I'm going to
Oh,
share that on your screen, and I'm going to edit your letter. Okay. Okay.
yeah.
Okay, then Nikat, I'll talk to you very soon. All
Okay,
right.
okay, sir. Thank you.
Okay. Bye.
So, and when do I need to send this?
By tomorrow. By tomorrow.
Okay. So